and these motor neurons, they are arranged in 3 columns: medially, laterally and centrally. Okay. Now coming to the dorsal horn neuron, this dorsal horn, it is dominated by neurons that responds to sensory stimulation. All the incoming sensory fibers in the spinal nerve will enter the dorsolateral part of the cord, adjacent to the dorsal horn in a dorsal root. It means the neurons in the dorsal horn will have the neurons that is bringing the sensation from the periphery, and these neurons will project to the higher level of the CNS to carry those sensations to the brainstem or the cerebral cortex or the cerebellum. Some of the dorsal horns, they participate in the reflexes. So, dorsal horn neurons can be divided into 2 parts: internuncial and traxal. So, there is no need to remember this internuncial neurons or the traxal. Just remember the dorsal is concerned with the sensory function and ventral is concerned with the motor function. Now, we can say dorsal root is sensory and ventral root is motor. That is also the part of the Bell-Mezendy law, like we have read in the synapse, the Bell-Mezendy law. Similarly, the dorsal root is sensory, dorsal root can never be motor, and ventral root can never be sensory. Okay. Now, white matter, coming to the white matter part. Within the white matter, the nerve fibers, they are arranged as either the ascending track or the descending track. Like either they will move upward to the CNS or they will be moving downward from the CNS to the periphery or the effector organs, right. So, white matter of the spinal cord is divided into right and left halves in front by deep anterior median fissure and posteriorly by posterior median septum. Now, if we look at that diagram of spinal cord, this one, what you are seeing over here, there is a term that is called as posterior funiculus. Similarly, there might be anterior funiculus and all. What are these funiculus? Like there is demarcation. This will be the median, this will be the posterior and lateral one. So, these funiculus are nothing but tracks or the collection of the nerve fiber which carry the sensation from the periphery to the central nervous system, or which is bringing the neurons from the central nervous system to the effector organs, okay, to the effector organs. So, there is posterior funiculus, there is similarly anterior funiculus, then there is lateral funiculus, and then there is commissure, means connecting part of the white matter, left half to the right half. If it is anterior, then it is called as anterior white commissure, and the posterior one is called as posterior white commissure. Now, coming to the spinal segment and spinal nerve, like I said, there are the 31 pairs of spinal nerves. Similarly, there are the 31 spinal segment, each giving attachment to the rootlet of the ventral and dorsal root of each spinal nerve. So, there are 8 cervical, 12 thoracic, 5 lumbar, 5 sacral and 1 coccygeal segment or nerve, we can say. And each spinal nerve, remember this thing, each spinal nerve is a mixed nerve and it is formed by the union of 2 roots, dorsal root and ventral root. Dorsal root is always the sensory and ventral root is always the motor, and they will unite to form a single spinal nerve. So, a particular spinal nerve will have the sensory as well as motor component, both the component. That is why it is a mixed nerve. Like as you can see in this diagram, this is the dorsal nerve root and this is the ventral nerve root. Now, these ventral and the dorsal nerve root combines to form spinal nerve, right. This is the spinal nerve, or it will be, and see this part, what is this? This is the Dermatome. What is dermatome? How will you define dermatome? Dermatome refers to the area of the skin supplied by one dorsal root, one spinal cord segment, we can say, like one segment. If like say over here it is written, say this L1, or say we are talking about L2. So, L2 is this part, this collectively, this total part, this part. So, this L2 dermatome means this is the area of the skin supplied by L2 spinal cord segment, right, L2 spinal cord segment. So, if we look over this diagram, see this one, this is the total functional anatomy. Okay, I will enlarge it a bit. Initially, like say white matter, okay, talk about the white matter. Within the white matter, there are the tracts and fasciculi. This is the white matter, and this part is gray matter, and these are the surrounding, the dura matter, arachnoid matter. Blue one is the dura, then there is the orange one, that is arachnoid, and inner one, this is the pia matter. Now, if we look at this one, within the gray matter, what it is written? Dorsal horn, that is the sensory, and ventral horn is motor. Then there is intermediate zone, or that is autonomic neurons from T1 to L2 and S2 to S4. Then there is a Clark's nucleus, that is T1 to L2. Now, forget about the Clark's nucleus for the time being. This one we will cover in the coming slide. What is the Clark nucleus? Just remember for the dorsal horn and ventral horn, okay, within the gray matter. Now, the spinal nerve, if we look over here, see, this is the spinal nerve, this is the spinal nerve, and it is having the orange fiber as well as this blue or purple fiber, right. What this purple fiber depict? This purple fiber depicts the dorsal root. The purple one, see, if we look over here, this is spinal nerve, and it's getting divided into two parts, the ventral ramus and dorsal ramus. Now, whether it is the ventral ramus or the dorsal ramus, they are mixed. It means they are having the sensory component as well as the motor component. You cannot say the dorsal ramus is sensory and the ventral should be motor. No, that means when we talk about the dorsal or ventral, that is the root, dorsal root over here. Dorsal root will have only the sensory and ventral root will only have the motor one. These roots combine to form spinal nerve. Now, we can say these two are the branches. Like just imagine this is a tree and this is the tree trunk. Tree trunk is called as spinal nerve, and this tree trunk has got two roots, dorsal one and ventral one, and these roots are getting connected with the spinal cord. So, dorsal root carries only the sensation, the sensory one, and ventral root carries the motor one. Now, this tree trunk has got the branches, and these branches have both the sensory as well as the motor one. Why? Because this dorsal branch, the dorsal ramus, dorsal means the posterior part of the body. So, it will carry the sensation, the sensory as well as the motor one from the posterior part of the body, right. And the ventral one, ramus, will carry, like it supplies skin of the anterolateral trunk and limbs and skeletal muscle of the anterolateral trunk and limbs. And for the dorsal, it is written skin of the back and the dorsal neck, deep intrinsic back muscles, that is erector spinae. Okay. So, this is how the cross section of the spinal cord along with the spinal nerve will appear. Now, this slide totally says like what we have read till now. What is conus medullaris? Conus medullaris is the caudal end of the spinal cord. S3 to S5, and in an adult it ends at L2 vertebra. What is coda equina? Coda equina means, as the name itself suggests, coda equina means it's like a tail of the horse. So this tail of the horse, these hair fibers, they are spinal roots. Okay. So the nerve roots of the lumbar, sacral and coccygeal spinal nerve, that is the coda equina. Okay. Then there is phylum terminal. What is phylum terminal? It is the pial extension of the pia mater. Pia is the innermost meningeal layer that tethers the spinal cord to the bottom of the vertebral column. Right. Dorsal root ganglia, it contains the cell body of the primary sensory neurons. Dorsal and ventral roots, each segment has a pair of dorsal and ventral root. Dorsal horn has sensory neuron, ventral horn has motor neurons, and these dorsal and ventral root will form a trunk that's called as the spinal nerve. It is formed from dorsal and ventral roots. So it will become mixed nerve. Then we have read about cervical enlargement C5 to T1 that form the brachial plexus that supplies the upper limb. Similarly, the lumbar enlargement is from L2 to S3, and this is called as lumbar and sacral plexus or lumbosacral plexus, which innervates the lower limbs, right? Or we can see in this diagram, the cut section, like it shows, there is this cylindrical shape, and then there is anterior median fissure. This part collection is called as anterior funiculus, and the central one, see the central one, grayish part, this is gray matter, and surrounding one is white matter. Within the gray matter we can see on each side there are three demarcation. This is ventral horn, this is dorsal horn, and this is lateral horn. Okay, lateral horn, and this is the spinal nerve. You can see there is a spinal nerve, and this spinal nerve has got the dorsal and ventral root filament, right? Dorsal and ventral root filament, it forms dorsal nerve.